minimal downtime. This is of prime concern for 43-year-old Ethna Weldon, who wants to fight the signs of ageing she's noticed in her face.
At 43, while I feel that, for my age, I look okay, now looking in the mirror, like I don't have the plumpness, like there was there 10 years ago. I find that, say, the jowls are more pronounced, in a downward way. I also am registered as a commercial model, and like attending open days and stuff like that, which are planned for the autumn. Like, it's kind of to look my best for that reason.
Ethna's decided to have a consultation at Venus Medical to find out which treatments would be suitable for her.
You'd be interested in something non-invasive, minimally invasive,
yes.
Surgical? What are your thoughts?
What I would like is something that's, the least invasive. Certainly something like general anaesthetic wasn't, kind of appealing to me. Maybe something that could be done under local anaesthetic.
Would you like to get a little lift in the lower face?
I think so, yeah, because I notice here, like the bottom part of the face, that kind of nice round is gone. It almost looks like it's more of a kind of a rectangle shape now, where it was kind of more defined along here.
Yeah.
Is kind of gone.
So we can achieve that actually under local anaesthetic. What we do is a modified version of what we call the one-stitch facelift. So it's a very minimally invasive procedure. It's a type of suture lift, and we do remove a little skin as well to reduce the bunching afterwards.
Right.
But the incision is right at the hairline, and I do that purely under local anaesthetic. Complications are unusual, but there's potential risks like infection, delayed wound healing, some numbness in the area, which is quite unusual as well, which would resolve over time. Do you smoke, Ethna?
I do. I had quit. I was off them for 3 years, and much to my own disgust, 2 years ago.
We would always ask that you stop smoking 2 weeks before and 2 weeks after any proposed treatment, just to encourage at least a better healing afterwards, for optimum healing,
Yeah.
And ideally forever, of course.
Absolutely.
Yeah.
That's my goal.
Yeah.
After the break, we see some instant results for Ethna and find out 43-year-old Ethna Weldon wants surgery to counter the signs of ageing. To get a clearer picture of exactly what can be done, Dr Prendergast takes a high-definition 3D image of her face. This is translated into a detailed computer model which can be used to view different skin features such as sun damage or rosacea. It also offers the simplest way to view the contours of Ethna's face.
The important part here is to look at the shadows. So if we tilt this like this, now we can see what we call the tear trough. And this is a little groove here. You also have a junction here, a shadow between your eyelid and your cheek. Without surgery, we can improve the appearance somewhat with fillers, very, very carefully placed fillers under the muscle here, because it's a very unforgiving area because the skin is so thin in that area. But you can see here also the mid-face volume loss. There's a shadow here. So you'd benefit from a little volume here in the nasolabial fold, because this fat pad, the nasolabial fat pad, is quite resistant to aging. It just doesn't tend to go away.
Yeah.
Similarly, the jowl fat, and you can see that here. This small little area here just interrupts the nice definition of the jawline. So the idea with the one-stitch lift is to lift this area, and then with the volume, to replace volume in the mid-face, perhaps a little in under the eye there, the nasolabial fold, and then with the beauty of simulation, I can show you what you might look like. So this is before and this is after. You can see how you just look softer and more refined, a little bit more volume.
Still looking like me, but
Absolutely.
a much, much fresher looking me, which that's what I wanted.
Okay.
Before the one-stitch facelift goes ahead, I caught up with Keene Gardner's Ethna and her husband Dave to find out how they're feeling about the whole process.
Did Dr Prendergast show you any kind of before and after types of photos of other women who've had this done?
Yes, and he's a few videos on YouTube that I watched as well, like, customers who'd had this done before. And, there were some kind of my age, there were some older. And he was right, it wasn't that, this 60-year-old woman now looked 40. But she looked very well for 60.
So you thought it was a good effect?
I thought it was a good effect, yeah.
In addition to the actual facelift, you're going to have some fillers in your lower face and Botox in your upper face. Those things wear off. Are you concerned that the effect of this, after all the outlay and the effort, won't last?
I kind of know like that it's not going to last forever.
No.
You know, and as he said, like even with this, you will still age, but it seems to slow it down.
So you're happy to look 43, but you want to look like a really good 43?
Yes.
Okay.
That's exactly the reason why.
David, can I ask you, you've heard everything Ethna has to say. How do you feel about Ethna making changes to her face? This is the woman you fell in love with.
I married Ethna for who she is. So she might have changed outside, but she'll always be Ethna to me.
While people are going mad in their 20s, I was busy being a mum, and now I feel like the 40s are the new 20s for me.
Yeah.
And, you know, I just want to kind of enjoy them, and I want to look well, and I want to look the best I can.
And Dave, obviously you're happy for Ethna to proceed. Would you ever think of having any work done yourself?
Absolutely not. I've been deemed as called a man's man. So it was just
So
not
all
for
right
me.
for Ethna, but not for you.
Absolutely, but not for me.
On the day of her procedure, Ethna arrives with Dave in tow. While they're waiting, I have a few questions for Dr Prendergast about just how popular these less invasive aesthetic treatments have become. So tell me, the perception is this area is growing and growing. Have you seen that in the clinic? Is it a growth area?
The statistics show that there's probably been a 700 to 800% increase in the non-surgical cosmetic procedures over the last decade, and maybe significantly less in the surgical. So there's a shift towards less invasive non-surgical and ambulatory procedures under local anaesthesia for sure. Number one treatment would still be botulinum toxin, Botox, fillers. We do a lot of laser treatments as well, the one-stitch facelift, full face volume restoration, and then I do lipoplasty to contour the body, fat grafting.
With these minimally invasive procedures, what kind of complications do you see?
So the most common complication or adverse effect with injectable treatments is just a little bruise or a little bit of swelling or a little bit of redness. Now that might sound like a small thing, but for people who want to go straight back to work or want to go out for dinner tomorrow night, a bruise can be a big thing. So even then we have to be careful to try to minimise the chance of bruising. It's in the consent forms as well. I think we're obliged to tell the patients of all the potential risks, however remote they are.
Ethna's having the one-stitch facelift with fillers and with Botox. What does something like that cost?
Usually the one-stitch facelift costs €2,500 or €3,500 if they're having the neck as well. And then it would increase significantly if they have volume restoration in the whole face, up to perhaps €5,000 or €5,500. So still significantly less than a facelift, or even some of the non-invasive skin tightening treatments can be quite expensive. But this is a holistic approach and where we're addressing the whole face. Okay, so the next part is to pass the little suture to lift the tissues.
It's like mum trying to get the high ponytail when you're a child. That's the sensation. Pulling it as tight as possible.
Fascia.
Now it's ready to tie. You feel a little pull.
Okay.
So done. Is it okay?
Yeah.
You can see here clearly the difference if you do this. And the tightness.
Once the process is repeated on the other side, Ethna is ready to receive her fillers and Botox. After a round of nerve-blocking injections, the delicate work begins.
Now you can see here quite a significant shadow between the eyelid and the cheek. So I want to try to reduce that. And if you squeeze on the plunger and inject under high pressure, you can inject some filler into these little blood vessels, and then they can go back the wrong way through the artery and then into the retinal artery and cause blindness. But you can inject into the nasolabial fold down here and still get blindness or stroke. So you can see here actually, Ethna, your chin is quite dimpled. Even when you talk it's like that. So what we'll do is we'll put 2 little injections of Botox in there and relax the muscle as well as your frown area there. It'll start working in about 2 days and you'll have the full effect in about 2 weeks, okay? Slippers. There.
Great. I am absolutely delighted. I'm absolutely delighted. Seriously, it's just wonderful. I feel wonderful. Yeah.
You look good. You do look good.
You can see it.
Yes. Yes. There's no pain.
No discomfort whatsoever.
That's great.
There's one stage in there where I thought I was going to fall asleep.
Thumbs up, Doc.
Ethna did very well. It was very straightforward. You know, I knew from the start she was a good candidate. She had realistic expectations. She didn't want something too invasive. She wanted something under local anesthesia that you could just go home straight away afterwards. So I think we've accomplished that. The one thing I would, really try to impress upon her is to stop smoking, because that will enhance results and prevent aging in the future.
Due to live coverage of the second Eurovision semi-final next Thursday at 8, Body Shopping will be at the later time of 10:05 next week here on 2. Stay with us now though. All new This Is Us is coming up next.